Hello and welcome back to another episode with Dr. Sophie. We have Mr. East today with us. Mr. East is an internationally renowned expert in rhinoplasty, and he's also the president-elect of International Society of Rhinoplasty. It's an absolute pleasure and honor to be here with you today.
Well, thank you very much for asking me to join in.
Today, I'd like for us to talk about non-surgical rhinoplasty. It has become extremely popular, and I see a lot of aesthetic practitioners out there advertising non-surgical rhinoplasty as a 10-minute nose job. I know it has its place, but I also know that it has a lot of inherent risks with this procedure. And as an expert in the field of rhinoplasty, I would absolutely love to hear your thoughts on that.
Okay, well, look, thank you for that. Yes, so fillers and changing your nose by injectables is something that seems to be very, very popular, particularly with a very young population who seem to want to experiment a bit. There's a place for fillers, certainly, and of course, the most important thing, obviously, is changing the contours with a filler. So it works very well in the profile. So if you want to camouflage a dorsal hump, or if you've got a saddle deformity where the bridge has sunk just beneath the tip, the filler can give a very nice result there. Of course, fillers add volume. They have to be put in the correct plane. And of course, they're temporary, but they're not as temporary as you think, because when we come to often do rhinoplasty surgery, I find fillers that have been injected sometimes 4 or 5 or even 6 years previously. And it does have a problem with affecting how the skin envelope reacts afterwards. So I think there's my advice in this scenario is, look, if you're going to consider your nose, talk to someone who can do both surgery or non-surgical, because for a lot of young people, the non-surgical option is not really an ideal one. It upsets the field. It can't change the shape of their bones. It can't reposition the nasal tip, or not significantly, and it carries risks. And I'm sure you're aware of some of those risks because too much upsets the skin. It can go through a discoloration. You can get the little infected little follicles, so you get a white pimpling effect. And in the extreme circumstance, you can cause skin necrosis. And particularly in the upper part, if it's injected in the wrong area, blindness, which is catastrophic.
Yes. These are some of the things that we've already talked about on our channel and you and I before, that any injection of any filler carries the inherent risk of blocking a blood vessel. And blocking a blood vessel is known as vascular compromise that can result in necrosis if that's not diagnosed correctly on time or treated. And of course, when it comes to the nose, there are blood vessels that go to the eye, and that can result in immediate and sometimes permanent blindness, which is not an ideal outcome at all by any means.
So I think there's a little bit of, it's been treated a little bit superficially in my view. It's, oh yes, it's a quick 10-minute.
Completely agree.
It's not. It's a medical intervention. It does not always dissolve. If you think it can be reversed, it doesn't always happen. And sometimes it may not be the right treatment for you. I see a lot of people who try it thinking it might be better and then realise that it doesn't achieve what they want. And ideally, they should have really come and had an opinion about their nose first, I think probably from a surgeon.
Absolutely.
Because then you have to ask them to have it dissolved out, and then sometimes it doesn't completely go. And we sometimes find this sort of fibrosis or lymphatic channel block, so you have more swelling after an operation. So they're not benign, but they have a great place, particularly if you do have an operation or you've had a trauma and there's a little irregularity. They work really well in terms of contouring, either the HA fillers or the collagen stimulators. So, yeah, they have a place, but I have a little anxiety that they're probably being overused.
You mentioned earlier a case where there was expansion of the nose tip due to the amount of filler that was placed. Could you kindly tell everybody about that?
Well, yes, I suppose this comes, we've looked at the microanatomy of the nose in our little preservation rhinoplasty group, and there are various little fat compartments and compartments where the embryological fusion planes come together. Now, if you inject into the wrong area, or if you're injecting into the interdermal fat pad, what you'll tend to do is make the tip go very, very wide. You inflate that fat pad. So instead of getting the projection, you get a broad nose. And that's something I've seen very regularly. Only yesterday, when we were doing a rhinoplasty, that scenario had happened, and we drained about 0.8 cc's.
0.8 cc's just from the tip?
From the supratip area. So the whole of the dome had been sort of blown sideways with the central part overinflated. So instead of getting refinement, what happened, the nose had become broader. So I think there's, for people who are going to do non-surgical rhinoplasty, it's really important to step back and relearn all this relatively newly appreciated anatomy, because it's really complex. Even for surgeons now, we've changed a lot of the techniques, understanding how these fusion plane works, where the individual pocket points are, and how the fat pads react in the nose. So I think that bit of knowledge will probably be very helpful for people who do want to do injectables.
Absolutely.
I think the problem is controlling where the filler goes. And if you don't quite know where the correct anatomical pocket is to insert it, you may find that the filler disperses in an area. You've either used the wrong stiffness of filler, or it's been injected in the wrong plane, and it diffuses in an area where you don't want it to be. The main risk with those is, I suppose, intravascular coagulation. Any injectable has a risk.
Correct, yeah.
Any injectable has a risk of occlusion or compression. Yeah, I don't think there's any way of easily
overcoming
circumventing that. Yes, but just having the correct knowledge. Some of the collagen, finer collagen stimulators probably don't last very long or won't have a big effect. But any injectable has a risk that you need to be aware of.
Well, thank you very much. I think this was quite useful. Are there any things you'd like to tell people who are considering either surgical or non-surgical? So I think one of the biggest points for me here is to consult with somebody who's an expert surgeon in rhinoplasty, and they can give you all your options. And it's not that they do non-surgical rhinoplasty as one of the things that they do. It's all they do.
Yeah, I mean, in general, I think my advice would be to consult someone who is an expert in the nose, full stop.
Yes.
Because you probably get a balanced opinion. Whether you follow their advice is up to you, but there are certainly some patients I would say, look, I don't think an injectable is going to achieve what you want, and you're better having an operation. Sometimes cost is a big issue, and affording a rhinoplasty and the time off is not something people want to do. So. But in general, yes, find someone who is an expert, someone who can deal with the complications, and someone who understands the anatomy properly. The simple things like changing your profile, that works well. But if you're hoping to change the shape or projection of your nasal tip, I think that's a big ask with fillers. So they will be better with an operation.
Well, thank you very much for your time today.
Sophie, pleasure.